what is everybody going to do now with pertuzumab in the adjuvant setting? So are we going to give pertuzumab and TDM1? Or are we just going to do TCHP or ACTHP? If there's no PCR, give TDM1 and no pertuzumab. What are we going to do?
The latter. The latter.
Right.
So lateral, just TDM1, no pertuzumab.
Correct.
We're exchanging one for the other.
Correct.
Yeah, but that's
They've
really
developed
important. That's an important
resistance.
point.
That's a
you know?
big point.
That's
I
a
mean,
big
that's
point.
huge because that's going
Because
to.
we see the affinity, we
have
had an
adjuvant
improvement in
affinity,
disease-free
right.
survival, particularly in the higher risk node positive. So we're backing away from that a little bit.
But
Probably
then,
going to.
But then you had Marianne that didn't show an advantage.
Yeah, an advantage. That's right.
So we're going to
That's right.
extrapolate to that and say no pertuzumab, just TDM1 in people who don't have a PCR.
I think the way I'm seeing the results of Catherine, that it's very similar to Amelia. So if you look at the metastatic setting, first line, Marianne TDM1 was a negative trial.
Correct.
But Amelia was positive, but that was second line.
Correct.
And this post-residual setting is kind of a second line setting.
I agree.
In
That's
that
the way I'm
mimics
looking at it.
that.
It's trastuzumab
As long as
resistant.
you've exposed somebody to
There was a
pertuzumab in that
survival
setting and they're
advantage with the
resistant to
Amelia
it.
trial.
That's a
too,
very,
you know,
that's a great
important,
point. That's a great way of looking at it. I think it's a,
Right, and that had
yeah.
a big impact on survival. And also the Teresa trial later line was also a very positive trial on
Right,
survival.
right.
So yeah, you really do see an impact in that more resistant setting.
What I'm really struggling with is the patients who are already on their adjuvant, trastuzumab, pertuzumab, and maybe they're 2 months in, 3 months in,
With
and
residual
then
disease.
with residual disease potentially, and what you'll do if they're 6 months in, if they're 9 months in, what are we going to do? And so, do you reset the clock exactly? And I think those are going to be
Heather,
really
that's a great question.
Those
Do you
are-
reset the clock?
It was
That's a
14
tremendous
treatments, it was
question.
14.
Cycles, right?
with significant fatigue
Right?
and a high discontinuation
You
rate.
guys, if you're using the adjuvant setting, it's not so benign. Yeah, you don't lose your hair, but
Yeah, but you know what? These women can do it. You know, they want the highest outcome, basically. You know, yeah, yeah.
Another potential impact of this is TDM1 is chemotherapy. So what happens with reconstruction along the way? If it's deferred, do you need to defer it? I think in ATTEMPT, you allowed for reconstruction after a few months on TDM1 if you were randomized to that.
Oh, really?
I don't know
Oh, wow.
what happened in
in terms
Catherine.
of, and in an attempt, we don't even know what the rate of post-op wound infection
Well, that's
was.
right. You have to see some
You
data.
have no
We have
idea
to-
yet.
We have to see
Right,
data.
we don't know the
Right, but
data.
at least the data are being collected. So
Yeah.
that's very important. That's great to hear. And I suppose that would maybe have also happened in Catherine, that they may have been allowed. I don't know that fine
I don't
point,
know.
you know, but attempt at least there's data on that. So that's very interesting. I mean, I think it's a discussion point, right? We go home, somebody's been on 3-4 months on their trastuzumab, pertuzumab. We go home and say, hey, we have these new data. It's 11% absolute improvement. Of course, that depends on where you're starting from, of course. You know,
But
depends on your
again,
risk.
someone who's 2 months into their adjuvant HER2-directed therapy, that's an easier discussion
What
than
about
someone
lines
who's
from the
further
end?
along. It's like, surprise, you thought you were 1 month away from finishing, and now I'm thinking
They had
about
patients who were
another.
N3. Did you see that in this trial?
I'm saying, say that again?
They had patients who were
Inoperable
N3.
disease. They had inoperable disease.
25%
Yeah.
So I mean, someone who was
inoperable from
N3, I
looking
probably would, who's been on it for a couple months, I probably would think about TDM. Oh
yeah.
Maybe something like that, yeah.
A great point in the sense, and it leads to the neratinib discussion as well. Say you go back to clinic on Monday, you have a patient who's been on 11 months of trastuzumab who had significant residual disease. Would I do TDM1 or would I consider neratinib for that patient?